Hello, my name is Dr. Dewan S. Raja. Today I will discuss about stomach cancer. The stomach cancers are mostly adenocarcinoma according to their histopathological features. Stomach cancer occur after 50 years of age in most cases. Male to female ratio is 2:1, more frequent in person with blood group A. The prevalence varies according to the geographic location. Suppose it is more common in Japan, Korea, East Europe, and Latin America than that of North America, USA, or Canada, and its prevalence is decreasing gradually. It also depends on food habits, socioeconomic, and cultural backgrounds. Etiologic factors include Helicobacter pylori infection, diet containing nitrosamines or other food preservatives, pickled food, smoked fish, excessive salt intake, achlorhydria, pernicious anemia, also history of GERD, gastroesophageal reflux disorder, obesity, alcoholism, smoking, or other etiologic factors. Okay. So stomach cancer involvement where it happened. Distal stomach is the most common site, specifically pyloric antrum, lesser curvature, and cardiac end of the stomach. This happens specifically to person who has GERD and Barrett's esophagus. And fundus of the stomach may be affected on rare occasion. Aggressive spread to adjacent and distant organ. So it may go to the spleen, it may go to the liver, it may go to the ovary, it may go to the lung. Virchow glands, prominent supraclavicular lymph nodes. By metastatic carcinoma of the stomach, so you can palpate the Virchow gland on the supraclavicular region. In many cases on the left side. Okay, so we got the Virchow lymph node. Krukenberg tumor, bilateral involvement of the ovaries by metastatic carcinoma of the stomach. Sister Mary Joseph's nodule, periumbilical subcutaneous metastasis from stomach cancer. Types of stomach cancer. Two types. One is intestinal type, another is diffuse type. Intestinal type is a polypoid, fungating, or cauliflower-like mass. May be ulcerated with elevated margin and necrotic base. Associated with Helicobacter pylori infection. You must remember that this is different from peptic ulcer. In peptic ulcer, the margin is not elevated, but adenocarcinoma, polypoid, fungating, or cauliflower mass ulceration will be associated with elevated margin and certainly necrotic base. Infiltrating or diffuse carcinoma, linitis plastica, leather bottle stomach, again associated with Helicobacter pylori infection. Stomach is thickened, rigid, extensive fibrosis, and infiltration of tumor cell. This is adenocarcinoma. It comprises 90 to 95% of all stomach cancer. Second most common is lymphoma, account for 4% of stomach cancer. Lymphoma is a MALT. MALT means mucosa-associated lymphoid tissue tumor here, lymphoma. Associated with Helicobacter pylori infection, lymphoma has better prognosis than the adenocarcinoma. Okay, here is the picture of a intestinal type of stomach cancer. We are seeing there is ulceration with elevated margin. Okay, here linitis plastica or leather bottle stomach. Here a lot of fibrosis here, and rugi has been lost from here. There is a common common presentation. If you study the cancer cell from here or from there, okay, so if you study the cancer cells from here or from here, we'll get this type of signet ring appearance cell. Nucleus at the periphery with a mucin vacuole here, with mucin vacuoles here. So multiple vacuoles, maybe one very large vacuole, and nucleus at the periphery, we call it signet ring cells. Okay, so this type of cell is a characteristic cell in case of carcinoma of the stomach. Okay, we got that. Now here is the endoscopic picture of the stomach cancer. Look like a cauliflower or polypoid, or it may convert it into cancer from the polyp, gastric polyp. So it is sometimes called polypoid, cauliflower like. Okay, or fungating mass here. That is the cancer here on the square picture. This I have taken from Microsoft PowerPoint online picture. We also got a pie chart here. So 80% of the gastric cancers are sporadic, 10% are early onset gastric cancer, 7% gastric stump cancer, specifically after gastrojejunostomy. The gastric stump is exposed to the gastric juices, acids. Okay, so if this is the happening, then we'll have gastric cancer. Gastric stump cancer, 3% hereditary diffuse gastric cancer is also possible. Okay, so here is the cancer. Usual site is here. Okay, but fundus may have on the body of the stomach near the greater curvature is also possible. Usually this is the site. This is the most common site. Cancer will spread through the lymphatic, may spread through the blood vessels. Here is the cancer cell. Okay, so it may go to the spleen, okay, lymph node. It may go to the lung. It may go to the liver. Okay, even this cancer may go penetrate the diaphragm, maybe in the ovary, may cause the Kuchenberg tumor or metastatic stomach cancer in the ovary called Kuchenberg tumor. Okay, so stomach cancer clinical feature is vague initially, but this is the common picture. Dyspnea, dyspepsia, not dyspnea, dyspepsia, indigestion, epigastric pain, hematomesis, that is vomiting of blood, melena means black, tarry and sticky stool, weight loss, fatigue, weakness, anorexia, anemia, and cachexia. These are the features of stomach cancer, clinical feature. It is dyspepsia. Okay, that is indigestion. Diagnostic is one type of indigestion. Diagnostic workup, upper endoscopy with biopsy, endoscopic ultrasonography, CT scanning. Treatment, gastrectomy with regional lymphadenectomy, and certainly chemotherapy. And that's all about the stomach cancer. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.